Hey everybody, this is Dr. Stott at Smile Now Dentures and Implants. Every single month I am looking on the internet to see what's going on with everybody with their implant experiences because I, just like you, would like to see what people's experiences are and see what kind of questions are out there. So this first one came, it was somebody saying, I keep biting the inside of my cheek and it hurts. When I'm talking, I'll just randomly bite it. I'm sure it's because it's swollen. Anyone else experienced this and did it stop? Ouch. I think one of the worst things to do is bite yourself. I've bitten my lip many times just with my natural teeth. It hurts so much. So there's a lot going on here. And especially when we have patients that come in, whether it be just a single tooth implant or it's multiple implants with like a whole new set of teeth, I think it's actually somewhat common to have to do adjustments to make them bite right. And what happens often is, like she said, if you are biting your lip, then it will be traumatic and that trauma will swell. And then all of a sudden you have more tissue there and then it gets in the way and you can bite yourself even more. So that definitely happens quite a bit. To make it better, you have to make it so you don't bite your lip or bite your cheek or whatever it might be. And so sometimes that's a little bit more difficult, but there are things that we can do to adjust your teeth, whether it be the position of your teeth, moving them in or moving them out, like more towards the tongue or more towards the lips, even making them taller or shorter. Say you can't open wide enough, or maybe your material's thinner, or like the teeth jut out in such a way. So there's a lot of different things that can cause this. It's totally adjustable. These are things that we can fix. Every single time that I do a full set of teeth for patients, I will actually put them through what I call a prototype. And a prototype is a set of teeth that is made just like finals are out of zirconia, but they're made out of a plastic type material. And then you will wear those for at least 2 weeks is what I like, but it could be 4, it could be, a couple months. My goal is to make it so you're 100% comfortable in getting the teeth that you want, because I know that you put a lot of time, energy, and money into getting this procedure done. So I think that pretty much covers that question. It was a really good one, very common for people. If you are biting your cheek, I would just go in, get those adjustments made. In my practice, we do remake teeth whenever necessary, and we try to do this all before going to the more expensive teeth, the final teeth, the zirconia ones at the very end. Okay, so another question I have is, I just found out that I will only have 12 teeth top and bottom after implants. Will I be able to eat normally again? I am anemic and crave steak from time to time. So also a really good question. An average human is born with 32 teeth, right? 32 adult teeth. These adult teeth include the wisdom teeth, and typically wisdom teeth do not fit in our post-industrialized jaws. So what that means is, for the majority of people, I served in the military for 7 years, the majority of people are gonna get their wisdom teeth out. And then they're gonna be down by 4, so they're gonna have 28 teeth. This person is talking about having 4 less than that, right? So what does that mean? That means that the average person has 2 molars, and then they have 2 premolars, and then they have canines, laterals, and centrals, top and bottom. What will happen a lot of times, especially when you just do 4 implants, is you won't have enough distance or support with the implants to go far enough back to be able to support the extra tooth, the 12th tooth that they're talking about, the second molars. How is that gonna affect you in your day-to-day? Well, I think psychologically, people love having all their teeth back, and that's kind of what they expect. So having 12 teeth, it's acceptable, but it's not unreasonable to also want 14. Is it gonna cause problems with your quality of life? Probably not. So are you gonna be able to chew less? Are you gonna be able to function in a worse way than if you did have 28 teeth? No, it's gonna be fine. In fact, a couple papers say that if you have a first molar and you lose a second molar, you're gonna have about 92 to 95% of the same occlusal force, or the ability to chew, than if you had all your teeth. So really not a huge deal. However, if you are interested in having 28 teeth or even 32 teeth, which could be possible, then what you need to do is you need to have probably more than 4 implants. I can't think of many people that can have 4 implants and still have that many teeth safely due to the overhang on the back of the arches or the back of the teeth. In order to have 28 teeth at least, you probably need to have pterygoid implants or a 5th and a 6th implant in place to help support those. My standard of care is 6 implants whenever possible. We have a slogan and t-shirts made that says more than 4. In fact, if you leave a little comment down here and ask for one of those t-shirts, the first person that asks for one, we'll give them a t-shirt. So will I be able to eat normally again? Yes. It's not really going to affect that. I don't think you're going to notice a difference with time. If you had 28 teeth, would that be better? Yeah, it can be better too, but you need additional implants in order to do that. I really hope this is beneficial. I enjoyed doing this. I do look online at people's questions all the time. It's hard to be a patient, and there's so much information out there, and I see people getting information all the time on forums or Facebook groups just like this that I don't necessarily agree with, having placed 10,000 implants. And so this is designed to help you understand the dynamics of implant dentistry, what tooth replacement options look like, and how to get them done. And if you have any specific questions that you would like me to cover in a future video, I would love it if you just comment or post down below. Say thank you. I appreciate that a lot. And until next time, this is Caleb Stott from Smile Now Dentures and Implants, and I will see you later.